Hi, my name is Brandy Butcher, and I'll be doing Component 1 of SIM 499 for the BSN SIMPath program for American Sentinel University. So, with this course, our first assignment is the comprehensive assessment. We were given a breaking news announcement regarding a hostile situation at the ABC daycare in Sentinel City. So, a little background about what they had told us was going on at Sentinel City daycare. The news that reported it was WSEN News for You. So, they said that the ABC daycare is located in southwest Sentinel City, that there was a gunman holding hostages. It's located on West Wing Street. There were no shots fired at this time. They were unsure how many people were inside, but it's possible that there are 6 workers and 30 children. There's also emergency response team on site. So they first learned about that there was a situation at the ABC daycare by social media. They said that they received several tweets. One was at Jay Leonard, says, "Someone please help. Locked inside a classroom and sounds like fighting outside room. Children are safe for now. Come quick, ABC Daycare Center." And then the other one was from Carmine Educator, and it says, "SOS, bad situation inside the ABC Daycare. Gunman holding hostages, teachers pleading for mercy." And then at Right Adam says, "Cops on scene at the ABC Daycare, keeping people away, but parents are frantic." So, to me, that says that the cops are already there and that there are also parents there, since it said parents are frantic. Julie is a field reporter from the news, and she says that the police are heavily armed, but no shots were fired, and police are withholding information at this time. The emergency response team has arrived, and that they only show up if it's serious. So, I'm going to be discussing first the environment and the people around the hostile situation and how these things can potentially impact the situation. So, people around, there is a coffee shop right down the road called Bean Coffee Shop, and it's maybe like 2 buildings down. And there were people out front. I spoke with Jennifer, and she has 2 kids, Carl and Carla, and she was out front of the coffee shop. She actually says that her kids go to the ABC daycare because it does a sliding scale and she's on a low income. Her kids were with her at the time that I spoke with her, though. There are multiple buildings around the daycare, and there's also, I saw a bookstore on the other end that's about 2 buildings down from the daycare also, so there may be multiple people inside the bookstore. There was an alley beside the daycare, so if the situation, escalated and somebody got out and was running down that alley or something, you can't see down the alley, but you can tell that there is one there. And I also saw that there are multiple 2- and 3-story buildings around the daycare. They look to be older in nature, and the front of the daycare is nothing but windows, so you can see inside the daycare at this time. And there's also a fire hydrant if needed on the corner of Lockheed Road. So the people that can be affected by the situation is, from the newscast, we were told that there are parents on scene already. So, of course, in that situation, if your child is inside, you're absolutely going to be frantic. You're going to be scared, and that will impact the situation because it's hard to keep your composure and to be able to just sit and wait and hope that your child is going to be fine. So, that would definitely impact the situation, and it could get out of control. So that's why it's good that there are multiple police presence available to help with that. Sentinel City says that the daycare is located in Casper Park. The population is 35,263 people. And it says persons under 5 in Casper Park is 10.9%. So 30 kids in there could be accurate, but there could also be more. Next, I will evaluate the leadership skills that would be useful in addressing this situation. So according to Elsevier, crisis management can be defined as the process where the indicators of crisis are obtained and assessed for the risk of a potential crisis, and where necessary measures are taken and applied in order to experience minimum loss in a state of crisis. So the leadership skills that I feel like you need to possess or to be useful in this situation is for you to be able to stay calm, give clear and concise roles and tasks, know your team and play to their strengths, be ready for whatever the situation entails, and be flexible when situations arise that you weren't expecting. So I think that you would need to be a strong leader, not someone who necessarily gets angry and barks orders, but somebody who is able to manage and lead a team by saying and giving them clear instructions. Next, I'm going to explain the potential public health effect and environmental hazards from this situation. So this situation could impact multiple people when going on the bus in Sentinel City. Like I said, there was a coffee shop that was close that had people out front, and the bookstore was right down the road, and there were multiple people outside. So we know that there's a gunman inside, but we don't know anything else. So we don't know if there's a bomb or if there's, like, they're going to release chemicals or anything like that. So depending on how the situation escalates would depend on how the situation gets worse or gets better. So if there were to be an explosion, multiple buildings could collapse. And given how close they are in proximity to each other, there could be an unknown amount of people that could be harmed or killed. Also, there could be long-term effects because the buildings appear to be old and may have asbestos in there. According to the Mayo Clinic, asbestos can cause lung scarring, and then you can have symptoms ranging from mild to severe, and they include shortness of breath, dry, persistent cough, and loss of appetite, chest tightness, and pain. I'm going to fully explain the individuals who make up the emergency response team and their roles that they play. So the emergency response team that I would think should be there would be paramedics, because they are skilled in all type of situations. They can start IVs, they can assist with any treatments, they can give medicines, they can bandage wounds, hold pressure. Then nurses, I think nurses could do all that same stuff, but I think that they also could do triage the situation and be able to determine who needs treatment first and who, is already not going to be able to survive or already passed away. And then doctors would be there to perform any life-saving interventions, whether it be a patient needs to be intubated, or they need a chest tube, or they need central line access, something like that. The doctors can be there to assist with any of that. Then police to ensure scene safety and to try to de-escalate the situation. Firefighters, there, if there were to be an explosion, they could put out the fire, or if there were to be a building collapse, they could help with search and rescue. And then, like I said, we're not real clear on the situation inside, so we're not sure what it might entail. So there may also need to be a hazmat team there in case there were to be any type of chemical spill or something. Describe the 5 rights of delegation and how delegate members of the emergency response team. So the NCBI says that the 5 rights are right task, right circumstance, right person, right supervision, right direction, and communication. So first you need to determine what tasks are right to delegate. So once you decide what tasks that you are going to delegate, then you need to make sure that you know your team. You need to be a team leader, and you pick accordingly what task you're going to give to each member. Like I said in the beginning, clear, concise roles. And then right circumstances. So you want to make sure that you're in a position to be able to delegate that task. If the situation does not warrant it, then you would not delegate it. And these tasks that you can delegate, you could also do yourself. So if you are in a position where you're able to do it yourself, you could also do that. And then the right person goes back to knowing your team. You want to make sure that the person that you are delegating to is able to do the task. And right supervision, ultimately you're the team leader, so whatever you are delegating is ultimately your responsibility. You will be supervising everything that you're telling them to do. Right direction and communication. I think that goes back to your leadership skills. You need to make sure that you give clear, concise roles and tasks, and follow up with each delegating task that you're given to make sure that it's complete and that patients are being well taken care of. Then I'm going to explain the services and resources that might be needed for the situation and the people in the daycare. So depending on how the situation unfolds, you definitely need medical services. If anyone is injured, you'd want them there on site, be ready to help. Police services to maintain scene safety and arrest or apprehend the suspects. Grief counselor resources. If there are any casualties during this situation, you'll want a grief counselor to be available to help. And then long-term therapy resources to be given to family members for post-traumatic stress. According to the ADAA, 67% of people exposed to mass violence have been shown to develop PTSD. Explain how to address family and the media as they arrive. So you want to delegate a person, put them in charge of public relations. You don't want to give any specific details to the media, just the facts about what is being done to de-escalate or control the situation. When addressing the family, show compassion and empathy. Try to keep them calm and as possible. Don't lie to them. I think that's the worst thing you could do. You may not be able to answer all the questions that they have, but don't ever lie to them about the reality and the truth of what's happening. Help them to understand that we're doing everything possible. I know that we learned about the situation through some tweets, and social media, can be very helpful in that aspect. It was their outlet to be able to reach somebody outside of the daycare, and it worked, which is great. However, I think it can be hurtful as well. With those tweets going out, it caused a mass hysteria and panic. It would be devastating to be on Twitter and just notice tweets coming from the daycare in which your child is at saying these things and not know what's going on. So, I think that social media definitely could be used for good. But as we see here, it can also cause further problems to escalate the situation and make it harder to try to get things under control. So that is my presentation. Thank you so much.